Welcome everyone to the latest installment of CADCA's Research into Action webinar series. I'm Sakjin Justin Hong, and I'm the Senior Associate on CADCA's Evaluation and Research team. And if you haven't previously participated in one of our webinars, the purpose of this webinar series is to introduce coalition members and substance use preventionists to current and relevant research being conducted in the substance use and community coalition fields. In today's webinar, we're delighted to have Dr. Nicola Zaharakis join us for this very exciting presentation on her findings from the recent article, Reducing Risk for Adolescent Substance Misuse with Text-Delivered Counseling to Adolescents and Parents, published in Substance Use and Misuse. And just to briefly introduce our presenter for the day, Dr. Nicola Zaharakis is the Research Assistant Professor at the University of Tennessee Knoxville Center for Behavioral Health Research in the College of Social Work. She earned a Master of Science in Clinical Psychology and a PhD in Applied Developmental Psychology from Virginia Commonwealth University. Before joining UT, she completed 2 postdoctoral fellowships at Arizona State University, the first on a NIDA-funded T32 grant in the Department of Psychology focused on implementation and dissemination science related to adolescent substance use preventive interventions, the second on a HRSA-funded grant in the Department of Social Work focused on opioid misuse prevention, treatment, and healthcare. Her work focuses on improving implementation and engagement with substance use prevention and treatment programs, with a particular focus on mobile health interventions. Now I'll turn it over to Dr. Zaharakis.
Thank you. Good afternoon or good morning if you're on the West Coast. I'm delighted to be here. Thank you for the invitation to present to you all and to meet with all of you who are doing a lot of the great on the ground work, which we super appreciate. My name is Nicola Zaharakis, as Justin said, and I'll be talking to you about an article that my colleagues and I published in 2021, last year, on text delivery counseling for adolescent substance misuse. There we go. So a little bit of a background on adolescent substance misuse, which I'm sure many of you are familiar with in the work that you do every day. Reducing substance use among adolescents really is the key and is imperative to preventing current and future problems in reducing initiation and escalation onto substance use disorders and related consequences. And there are a variety of different factors that influence substance misuse. Some of the key ones you see here are demographic, individual, and social factors. But as an intervention psychologist, an intervention researcher, we really try to target malleable risk and protective factors. So risk and protective factors, you all may be familiar with those terms, right, that we use in the scientific literature. Risk factors being those that may increase an adolescent's risk of initiating or escalating their use of substances, and protective being those that may help to prevent them from engaging in those sorts of behaviors. But we really try and target the malleable ones, right? The ones that we can actually change. There are lots of factors that are not changeable. We can't change our genetics. We can't change necessarily sort of where we come from or some of our demographics. But there are several factors that we can change in relation to trying to prevent or reduce adolescent substance misuse. Some of the key ones that have been identified in the scientific literature and that I'm going to talk about today in terms of the intervention we tested are related to teens' mental health problems, so particularly symptoms of depression and anxiety, and also parenting skills that have been identified as useful preventive factors or protective factors in terms of keeping folks from, or keeping teens from engaging in unhealthy behaviors like substance use. My colleagues and I here at UT do a lot in the realm of mobile health interventions. So mobile health, you're probably familiar with the term or can assume what that means, but as you can see in the picture, most of us all the time are on our phones nowadays, particularly the younger generations do a lot of social media, a lot of engaging with their friends and peers, and lots of things that we use our phones for every day. And so we've been working in that space for a while now to try to reach a broader audience, get to some families, some teens, some kiddos that we might not otherwise get to, that might not have access to more traditional face-to-face interventions, or might not be interested in such interventions. Mobile health interventions can really include a few different things, including sort of apps. So mobile apps that might be developed, and some, outside of the substance use world, some you might be more familiar with, like the Calm app or things like that. We work a lot more in the text message intervention world. I'm trying to do some counseling via text message, and I'll show you a little more of what that looks like. But our work, as well as some from other fellow scientists in the field, has shown success in using this method. So in particular, some of our past research has shown success in reducing adolescent alcohol and tobacco use using these methods. So the intervention that I'm going to talk about today, really two interventions, a parent intervention and a teen intervention that we evaluated related to preventing adolescent substance misuse, with a particular focus on prescription opioid misuse, but really substance use in general, in partnership with a federally qualified health center here in Tennessee. And the goals of this pilot project that I'll talk about were sort of threefold: looking at the feasibility of it. Could we integrate these procedures, this study, into the clinic where we're working and get folks to screen and engage and enroll in the project? Are the interventions acceptable to the parents and teens that enrolled? What are their perceptions of the intervention and its activities and its content? And of course, the efficacy of it. So did it actually make change in the risk and protective factors that we're targeting and in preventing substance misuse or escalation of use? So for this project in particular, we were able to recruit 69 adolescents and 52 parents. So parents had the option to enroll, they were not required to enroll. But those who did enroll were randomly assigned to the same condition as their teen. So they were screened and enrolled, and then randomly assigned to either receive the text message-based intervention for 4 weeks, which I'll tell you a little more about, or to be in a waitlist control condition where they completed the study surveys, and at the end of the study had the option to enroll in the intervention if they chose to. Our eligibility, the sample we collected was based with teens from ages 13 to 18 who were fluent in English. They had access to a text-capable phone for the 3 months of the study, didn't have any conditions that might prevent them from consenting or participating in the project. And the teens were patients at the FQHC that we were working with. The FQHC we worked with is here in Tennessee. Some of you may be familiar with it. The Cherokee Health System, which serves about 72,000 folks in Knoxville and around the Eastern Tennessee area annually, and has a diverse payer group, although a large portion on the sort of lower socioeconomic status, as you can see there, majority being Medicaid or Medicare patients, about a quarter being self-pay, and then a smaller chunk being those with commercially available healthcare insurance. For this study, we did assessments at the baseline before we randomly assigned folks, and then at the 1, 2, and 3 month follow-ups. Excuse me. So to give you a little sense of where Tennessee is, and I was glad to see everyone's, where everyone who's calling in today is from. I love to know where folks are from. I'm not from Tennessee originally, I'm from New York. So I did not know where Knoxville was before I moved here, but give you a sense of where we are. Knoxville's in Eastern Tennessee, just outside the Smoky Mountains, on this side of the Tennessee-North Carolina border. Most of Cherokee Health System's clinics are in Knoxville or in the surrounding counties, as you can see on the map there. They do have a few satellite clinics out on the other side of the state in Memphis, but mostly here in Knox County and then some of the surrounding counties, Blount County, Scott County. That picture is their main clinic site, which is just up the road from campus. And we're here at UT Knoxville and the Center for Behavioral Health Research, as Justin said. So what are these interventions that I've been talking about? Two really, excuse me. So the adolescent intervention is an adapted version of an intervention that my colleagues have been developing for the last decade or so. It's called peer network counseling, really spearheaded by Michael Mason, my colleague and mentor over the last decade. It's based clinically in a motivational interviewing framework, but also theoretically in social cognitive theory, and really focuses on what we like to call sort of peers and places. So trying to help folks understand the influence of their peers, both their peers' pro-social and risky behaviors, and how that might influence health and substance use, as well as the places where these behaviors occur, and using those things to sort of help folks try to make changes to their substance use or to their health behaviors. We've tested this in a variety of trials over the last decade and found some evidence for its effectiveness in indicated prevention and treatment samples. So indicated prevention, not universal prevention. We haven't tested it in that way just yet. The indicated prevention, working with youth who may have started to experiment using substances, may have started trying cigarettes or alcohol, but not yet progressed to more regular use or a disorder, as well as treatment, those who have met the clinical guidelines for a disorder. And in some of the past papers that we've published, we've shown reductions in tobacco use among teens, reductions in cannabis use among young adults with a cannabis use disorder in a couple of pilot projects that we did in Richmond, Virginia, as well as here, as well as increased motivation to change alcohol use in young adults. Right now, we have a large National Institute of Drug Abuse funded grant to look at PNC as a treatment for cannabis use disorder in young adults, in about 1,000 young adults, half in Colorado, half in Tennessee. But this is more focused on prevention, on the prevention aspect, which I love working in that space and was really trained as a prevention scientist. So as far as the structure of the intervention, it's 16 days of automated personalized text conversations. So that's to say there's no counselor sitting on the other side of the computer. It's all programmed, and I'll show you that in a little bit. The day after folks complete their baseline survey and enroll, the next day the text messages start, and they get the text message conversations every other day for a month. And the responses that they get back from the automated program are based on how they respond and are personalized with information from that baseline survey to try and make it a little more relevant to that particular individual. We still focus on peers and places, but adapted it a bit to really be a bit more about risk reduction and about health promotion and helping teens understand what stress is, how they might cope with stress, different strategies to plan ahead for those sorts of things. In addition to the 16 days of personalized conversations, they have a few boost options where they can get additional supplemental supportive messages. So tips for how to cope or messages around dealing with stress and things like that. The parent intervention, similarly as a 16-day intervention every other day, automated conversations, a little less personalized than the adolescent because we created the parent version of the intervention for this study. It's really based in a behavioral skill developmental framework on the work of Tom DeShawn and Jerry Patterson, and focuses on some of the key parenting skills that we know from the literature, from the scientific literature, that are effective in helping to reduce or prevent substance use. So encouraging parents to communicate with their children, check in with them, try and build a relationship and avenues to have regular conversations, helping the parent understand how to monitor their child's whereabouts, where are they going, where are they spending time, who are they going with, encouraging the parent to convey their expectations around substance use, particularly disapproval of substance use, what the rules might be for their child engaging in substance use if the parent found out about that, as well as parental involvement. So getting the parent involved more with the child, helping them to build activities together. In this study in particular, we recruited 69 adolescents, as I mentioned. About 2/3 of them were female, with a mean age of about 15, when the range being 13 to 18. And about a little more than 3/4 were a white racial background, which is pretty similar to that of the Knoxville area, with about 9% Latino and about 7% Black or African American, and some smaller percentages of other racial groups. Of the 52 parents that enrolled, a large majority were mothers or female caregivers, about 90%. Like the adolescents, even more so, about 85% from a white racial background, about 11% Black, and about 4% multiracial. Almost a quarter of them held a bachelor's degree, and about a little more than a third had private healthcare insurance. So a fairly diverse sample of families that were recruited into the project. To give you an idea of what some of the text messages might look like. So in this project, of the 69 adolescents, 34 were randomly assigned to the Adolescent Text Treatment Program. Here you can see some of the text messages. So where you see bold and uppercase letters are where things are personalized and piped in from their survey. So we start out all of our text interventions with a question or two. So here for this project, we asked teens at the beginning of each intervention day to rate their stress level on a scale from 0 to 10. And so you can see they text back, in this case, a 5, and that moves them on to the next conversation. And then we start going through the content for that day. So here, I hope this is large enough to read, but you can see it says, okay, thanks. Like, reactions to negative life events can have a big impact on us. So let's review some unsafe or unhealthy ways to handle stress. And then often every few messages we'll ask them to text okay, to sort of move things along and try to mimic a little bit of a real conversation. Then in the next section, we talk about, examples of unhealthy ways to deal with stress might include using drugs or alcohol, hurting yourself, letting someone hurt you, acting on impulse. And then we try to incorporate some questions. So we ask them, do you think that your use of any unsafe or unhealthy ways do you think that using any of these are unsafe or unhealthy ways to deal with stress? Trying to help them reflect on what their thoughts are and using sort of that motivational interviewing framework. And so they text back too for sometimes. And so we say, okay, thanks. Think about a really stressful week that you've had recently. Let's think of healthy ways to handle stress. And text okay when you're ready to continue. And so it stops for a couple of minutes and hopefully gives them a little bit of time to think about a recent stressful event and some of the details of that. And then we move on in that second picture of the phone there to say, so let's look at some ways to deal with stress, and let's pick one to try next time you feel stressed out. And so what you don't see here is that there would be a little icon or image to click on and bring up a list of 10 ways to different coping skills or coping strategies. And we'd give them a couple minutes to read through that and then choose one of the skills, which are numbered 1 to 10. And so they chose number 2. And then we move on and say, okay, good. So see if you can use coping skill. And here it would actually pipe in or populate the skill that they chose from that list. And say, see if you can use that over the next couple of days to help you manage when you feel like you're in a tough situation or you're feeling upset or stressed. Thinking about this and being ready to handle stress when it comes your way is helpful. And we remind them that they have those options to get additional supplemental messages. So to choose boost or to choose how to deal, there are a few different options. And so they can text those at any time in between the messages to get that additional supplemental material. At the end of every day, we always thank them with their name and let them know that that is the end of today's text messages, but that if they need more support, they can text boost to get to those different options. And we let them know it's not being, that these messages are not being read immediately. We do, when we have these projects going on, read the text messages a couple of times a day, at least in the morning and the evening, to make sure that if there are any reports of harm or self-care or suicidal, harm to self, harm to others, suicidal ideation or abuse, that we catch that and follow up on it appropriately. But we do encourage them to, if they're in the middle of a crisis at that moment, it might be a few hours before we actually read these messages, to call 911. And in our more recent, we did this a couple of years ago, in our more recent projects, we encourage them to call 911 or 988 now that that national crisis hotline is available with the quick call numbers. That was not yet active when we ran this. As far as the parent intervention, here's a sample of that. So 23 of the parents were randomly assigned to the parent text conversations. And similarly, we try to personalize it a bit with their name and start them off with a question each day. So here in this day of text conversations, we asked, have you communicated or reinforced your rules about substance use recently? And asked them to text back yes or no. And so then we try to give them some education about some of those parenting skills that I mentioned earlier. So we say, now we're going to talk about checking up and communicating. Checking up means that you check to see if your teen is where they're supposed to be. So we give them some options to do that. You can text them, call them, even stop by where they said they're going to be. How do you usually check up on your teen? And then give them some ideas to try. So around communication. So letting them, or encouraging them to use open-ended questions instead of closed-ended questions. So try to think about how to ask questions to your teen so they feel like talking. So instead of asking, why are you hanging out with Jack? Maybe trying, it seems like you and Jack are hanging out a lot lately. What do you guys like to do together? And trying to invite the teen to share a bit more information than they might otherwise answer, and giving them questions that they can't just necessarily answer with a yes or no. We try to let the parent know, this may help the teen to not feel judged and to share more with you. And if you show real interest in them and their friends and try not to show disapproval, it helps the lines of communication. But we validate that we know this is hard. Parenting is hard, especially in the context of our busy daily lives. But letting them know that, trying this out, being consistent with it will help your teen to feel more open to you. As with the teen text, we let them, know at the end of each day, this is the end of today's text, but if you would like additional support, you can text boost for some of those supplemental materials. So I won't go into a ton of this, but just to give you a tiny bit of background. As I said, there's no counselor sitting on the other end. I and my staff do read the text messages to make sure that we're not missing any crises that folks may report to us. But the majority of the intervention is really programmed like this. So we use a program called Text It, which is, you don't need to be a computer scientist to use it. We've had research staff sort of take some time to get used to and to learn how to use, but you don't have to have a computer science background. I don't, none of my staff do. Just take some time to sort of program all of it, and then particularly sort of test all of it and make sure that it's working the right way. This is not from this trial in particular. This is from the cannabis project that we have going on right now. But just to give you an idea that, they start a flow, the text message comes through, and then depending on their response, is programmed to sort of move on to different options. And in this one a little bit, you can see sort of on the left side here, all of the messages that are incoming every day are always ran through what we call sort of a crisis flow. So they're programmed to catch, if folks talk about harm, abuse, suicide, hurting themselves, that immediately sends an email to me and to our clinical team to let us know that, hey, there's a message that came through that maybe related to someone having a crisis, you may want to follow up. And so then we get together and follow up as appropriate, reach out to the person, reach out to the parent if it's a teen, and report those as necessary. Quick overview of measures, just so you have some sense of the measures in particular for this project. Of course, we collected age, sex, and race. We looked at the frequency and the completion of the intervention as part of that feasibility goal. We looked at folks' reports. Parents and teens both reported on their satisfaction with the program and how acceptable they thought it was. And then to look at our outcomes, we collected information from the teens and parents on anxiety and depression. That was really the teens. We collected information on their anxiety and depression symptoms, on the adolescent-parent relationship and the quality of that relationship, and on parenting skills. So on those parenting skills, we talked about the frequency of using sort of communication styles and communication between the parent and child, monitoring the child, conveying disapproval of substance use, and being involved in the child's life. We also collected a saliva drug screen from the teens at baseline and at 3-month follow-up to biochemically verify what substances they might have been using during that time period. This isn't all of the substances that saliva drug test captured, but just giving you a snapshot of some of the more frequently identified ones. So on the left, you see the baseline rates, any drug use, so any of the drugs listed on our panel was somewhere between 11 and 21%. Our treatment and control groups were a little bit different in that at baseline. Sometimes that happens with smaller samples. You can see the most frequently used or most frequently found drugs on the saliva drug test were marijuana and cocaine and some opiate use. On the right, you can see the 3-month follow-up. Both groups seem to have gone down a bit, particularly the treatment group, so we were glad to see those results. But in terms of our stated aims that I talked about earlier, looking at the feasibility and acceptability, both adolescents and parents really found the intervention feasible and acceptable. So almost all, 94% of teens, 98% of parents completed all 16 days of the text conversations. So that's great. We were glad to see that. And all of the adolescents and almost all of the parents, 91% of parents, tried at least one of the counseling recommendations that we offered in the text message conversations. Some work to be done on some parts of this. So a little less than 80% of adolescents and parents, 79% of teens, 78% of parents said that they found the text to be helpful to them. So that's something we are thinking about and working on, and I'll talk about in a minute. And then interesting, a little bit of a difference there. So 91% of teens said that they found the text to be private, whereas 61% of parents said they found the text to be private. So another thing that we're thinking about and gathering some more information about, but potentially also likely some cohort differences there, right? Folks in the parents' age range, my age range, folks older, maybe are a little bit less comfortable with text messages and phones as we didn't grow up with them, whereas adolescents today have really had them from a much younger age and feel a lot more comfortable communicating in that way. As far as the most frequently tried skill, teens reported most frequently trying out the stress management skills that we talked about in the intervention. So trying to exercise more or trying some relaxation techniques to help them deal with the stress or difficult situations in their life. Whereas parents most frequently reported trying to use the active listening skills that we talked about in the intervention. About 80%, just under 80% of teens said that they did learn some new ways to deal with stress in their life. And about the majority of parents, 91% of parents reported that the text made them think about their relationship with their teen. As far as the efficacy of the intervention itself, so compared to adolescents in the control group, adolescents in the intervention group at 3-month follow-up had reduced depression and anxiety symptoms. And they also reported a higher quality of relationship with their parent and increased parenting skills from their parent. We also saw marginally lower odds of those positive drug tests. So that wasn't significant, but with a smaller sample and with the short timeline, we might not have expected to see, significant results there, but gives us some hope that as we continue to improve this intervention and maybe look at it in a larger sample and over a larger chunk of time, that we'll be able to make more movement in reducing drug tests and reports of drug use there. Interestingly, we didn't find any significant results from the parent's perspective. So we didn't find any significant effects on the parent-adolescent relationship or on parenting skills per the parent's report. We did see increases in both of those, in the parenting skills and the relationship, from reports of parents in both the treatment and the control conditions, though we did see bigger increases for the intervention group. So again, that was just the first test of this parent intervention, but as we begin to tweak it some more and do some more work, we hopefully will be able to make some bigger gains there. And many of you may be familiar with your work in the field or with some of the scientific literature that suggests that this is not uncommon to find different perceptions reported from adolescents versus parents. So adolescents are the ones reporting a higher relationship quality and more parenting skills. Parents are not, but our ultimate outcome is sort of on the adolescent substance use, and the adolescents are the ones perceiving that. So there's some movement being made there. So some takeaways from this initial study suggest that, text-based counseling may be an effective way of targeting risk and protective factors for adolescent substance use. So we saw some change in reductions in depression and anxiety, and some marginal change in adolescent substance misuse. Compared to internet-delivered interventions, so really those delivered via computer, which have been around now for a decade or so, the effect sizes with our project, in this study anyway, were 2 to 3 times larger than those from an internet-delivered intervention. So we're hopeful that that will continue to move on and allow us to make larger gains using this method of intervention. Because text-based counseling is a cost-effective and more scalable option to reach larger populations, right? There's lots of work in the app-based world, which is also great. Some of that shows that folks initially sort of engage and then drop off. But text-based things may be more able to be scaled across larger populations, particularly those from lower socioeconomic backgrounds or countries where there's lower SES, as texts have become over the last decade or so, sort of a common feature of phones, and that folks are much more comfortable and used to using that method of communication. And just a little bit of a preview of sort of where we're going next with this. We're currently getting ready to start some interviews with teens and parents and some of the staff at Cherokee Health System to gather some information on how we could better improve our recruitment, enrollment, engagement of families into this trial, and how to better integrate these sorts of procedures into the clinic's daily operations. Part of that in pre-conversations with the clinic is translating some of these materials into Spanish. So Cherokee serves a large immigrant and refugee population in the area. And so we are working to translate some of these materials into Spanish, and we'll do some of those interviews in Spanish to see how we can best recruit that subgroup into our study and then into a larger trial. And we'll use these data to plan for a larger trial and to apply for a National Institute on Drug Abuse grant to test an improved, intervention, parent and teen intervention with Cherokee's partnership in a much larger sample. And to be able to see, can we replicate these results that we've seen in the pilot? And can we really look at these improvements? Do we really see, reductions in substance misuse, reductions in anxiety and depression, increases in parenting skills and parenting relationship? And are those the mechanisms? So is the intervention improving parenting skills, anxiety, depression? And is that the pathway by which we're then reducing substance use, which we need sort of a larger sample to look at in statistical methods. So thank you all for letting me share that. I am happy to answer any questions that may have come up for you, or have a discussion about what you think about all this.
Alrighty, thank you so much, Dr. Zaharakis, for your wonderful presentation. We're very fortunate to have you kind of sharing your findings with the coalition members and also the preventionists who are attending this webinar. And so just before I go into the participants' questions, so I already have prepared a couple of questions myself that I just wanted to ask you before to kick off the Q&A. And if anyone else has any other questions they'd like to ask Dr. Zaharakis, please feel free to put that in the Q&A box. Okay, so I'll go ahead and kick it off here with my first question. So what specific aspects of the intervention did you feel were most effective in reducing these risk factors? I believe you said it, anxiety and depression in adolescents.
Yeah, thank you. I think we have some ideas. We're hoping to, dig into this more with a larger trial and really be able to test some different pathways of mechanisms. But from the data thus far and the, reports that we got from the teens and the parents, we think that what's happening is, that we're helping the teens sort of think about some other ways to cope with stress in their lives, to sort of plan ahead and have some things in their pocket for, if I have a tough situation, here's some ways that I can deal with it. And to think about anxiety and depression, as the intervention did not specifically target anxiety and depression, but to think about stress as something that is natural and comes up in the daily lives, and that they can find ways to manage. So, for example, as they said, they most frequently sort of tried relaxation, exercise, some other ways to cope with some tough things coming up in their life. As well as, from their perspective, it seemed like they felt that they were developing a better relationship with their parents and getting some better involvement and communication from their parents. And so I think those together, being sort of some of the factors that help to reduce anxiety and depression and eventually prevent some of that substance misuse.
Got it. Thank you for that. And going on to the second question I prepared. So you mentioned the idea of text-based intervention being a more accessible and wide-reaching form of counseling, even more so than like the smartphone apps, just by the nature of text being, more easily accessible to a wider group of people. And so do you foresee any barriers to effective implementation? And if so, how can we navigate the challenges?
Yeah, thank you. So this is the meat of the things that I am particularly most interested in. Some of my colleagues that I work with really do the testing of the interventions themselves, and I'm particularly interested in how do we implement this? How do we get them out of our lab and out to you all who are actually doing the work with folks on the ground, right? And I think these are questions that we're wrestling with right now and trying to figure out how do we move them out? I think there are, potentially a few barriers. I do think that the text message interventions may be more accessible than apps and things like that, because you don't necessarily need data. You don't need to worry about being on Wi-Fi, which is still an issue for lots of folks in different communities and rural areas in different parts of the country. We do also, I think one thing we're struggling with a lot is thinking about how do you manage this? So it's all automated, right? You don't necessarily have to pay for counselors to sit on the other side and text folks back, which is great, more cost effective. But we still have to have folks, number one, sort of program this stuff, and number two, monitor it. And the programs that we're using, like I suggested, are not, you don't have to be a computer scientist, but how do you sort of create that kind of position? Is that, sort of someone at the university that you're working with that can monitor that? Is that a position that you can create within a clinic or within a community agency who would be sitting and monitoring this to make sure that the systems are running and to be checking for these crisis messages in case folks need an additional level of care? So we're trying to figure out sort of how, what might be the best system for that? What might be the model for having somewhat of a position like that? Or could that be built into, a preventionist job at an agency, or, part of an interventionist within a clinic? Could they be trained to do some of that work? As well as sort of, so that's one sort of the logistics end of it. And then I think the other is sort of thinking about sort of the payer model. Does this, we've thought about sort of startup businesses, and could we sort of offer this to the community directly? Is that something that they would want? And what would be the price point that might make it feasible for folks to engage with it? Or is it something that we really need to think about offering to agencies or clinics? And what would, that payer model look like? Would it be through health insurance? Would it be through sort of an agency's block grants or things like that? And so those are things we're hoping to move forward and, begin to sort of test more and gather more information on. But I'm open to ideas and thoughts on that, as, you all are actually in the field doing all this work. So.
Wonderful. And I think the next kind of question I had ties in with that pretty well. I guess my assumption was in the future, if this becomes something that is widely accepted by our community coalition members, how would they be able to incorporate this sort of text-based counseling into the respective intervention strategies? And by that, I mean, of course, I wouldn't expect it to necessarily replace anything, but rather supplement in addition to the existing strategies. So how do you think it could be incorporated well?
Yeah, these two, are related questions that we are trying to figure out some more, and they're really important questions. So I think with the programs that we use, they could be something that, agencies, if they had the funding and the folks to do it, could take on and do themselves. We are trying to find ways that we can sort of package this and offer it to community agencies or clinics or folks who are working out in the field, to incorporate into their daily work. A lot of the work we've done so far has been with clinics, and so we've thought some about, how do we integrate this into the EHR, the EMR, and the electronic, health record or medical record, because it's all sort of tech-based, right? And so it seems to make most sense to sort of, could you come in and check in for your pediatric appointment for your teen, and have this sort of be a flag that pops up that your doctor or nurse offers, like, hey, here's this, parenting program that we can offer to you that can help your teen deal with their stress. Those things are still somewhat more costly than I originally thought, I guess, to sort of get things integrated into an EMR. So we're still thinking about those as potential options, but are looking for other ways to package this and offer it to folks in the community through, through the university or through sort of smaller businesses that we can offer this to folks. And, I think regarding the second question, thinking about what structure do we have, what staff do we have in place to be able to keep an eye on what folks are reporting back, and to have some follow-up from, whoever it may be, the nurse, the doctor, the community agency that you're working with, to sort of not just send folks off and say, hey, do this, but maybe to check back in regularly with these families, with someone that they trust, that maybe is in person with them at a visit, to see, is this, useful? What discussions has this sparked between you and your teen? What changes has it made in your relationship or in how you're monitoring them, or in how they're, dealing with stress and the things they're doing in their day-to-day life?
Got it. Yeah, I think that's wonderful. We actually had a question from one of our participants asking if there's anything available from like the upstate New York area, for example, but it sounds like it's kind of in the works of being packaged to be made more accessible for everyone else.
Yeah, I think as far as text message interventions, the one that's probably the most frequently out there, although it's not really a prevention end of things, it's more on the treatment end. The smoke-free CDC program that's out there is really, focused more on helping folks cut back on tobacco use, and they have a variety of different options for teens and adults and pregnant moms and things like that. And is the most, I think, widely known and widely implemented program, and they do it for free because they pay for it through their agencies. But I'm not yet aware of any that are actually, being implemented and available within the community, but we are pushing hard to get things there sooner than later.
Awesome. I think our CADCA members would be very interested in that. So we will definitely stay tuned for that. And just to go back to the second part of the question, you already kind of touched on this, but with like the back and forth with text messaging, with kind of like automated responses, how can we ensure that these messages and questions are yielding fruitful discussions? And how do we, how have you found, like what have you found to be effective in making sure that people are actually reading these messages and really kind of taking them to heart?
Yeah. Again, I think things that we are trying to move forward and look more into. So I have been trying to do some work in looking at, different aspects of engagement, adapting them from some of the work that's been done in the app world. So in the app world, they sort of look, a lot at sort of what pages have been clicked on, how much has been spent on different pages. We're trying to adapt what's relevant to text messages and sort of think about, we do have timestamps of start and end, and try and look at how long do they take to get through these text messages. Are they just, and we're assuming things from that, right? But if it's, you're just clicking through them in 60 seconds, boom, then maybe you haven't actually spent as much time as if you spent 10 minutes going through the text messages. Maybe you've spent a little more time thinking about some of the content being offered to you, as well as sort of looking at, how frequently are they, it looks like, at least in this project, as well as in some of our other pilots, folks completed, all or almost all of the intervention days that were offered, the 16 intervention days, but trying to look at how frequently folks are accessing some of the supplemental information. So the boost messages, the how to deal, those sort of options, to see, are they trying to engage with it even more? As far as whether it's, yielding fruitful discussions between parent and child, I think a couple things. I think one, I would love, and we're planning to sort of, gather some information on that in a larger trial and ask folks, how has this encouraged you to engage with each other? we'd love for us to, and we hope to in the future, sort of integrate these a bit more and have some back and forth between the teen and parent interventions, and offer them some options to communicate with each other, or activities where they can engage with each other, to sort of encourage that even more so than just sort of educating each of them individually. Old school methods, which are, you know, a little harder to do, but always effective in trying to understand this. Tom DeShawn, you know, we based some of this parenting work on. He was my mentor, one of my mentors at Arizona State, and has now since passed, but really was a proponent, and he learned that from Jerry Patterson, of really bringing folks in. They developed the family checkup program, where part of that was an assessment to referral, but they would bring folks in and really do sort of a few minutes of giving the parent and child, you know, a discussion topic or an activity to do together, and then sort of observing and coding some things from the interaction there, which is more intensive based research to do, to actually ask folks to do that. But you can gather a lot of information as to how helpful the intervention is working, and sort of targets of where you might be able to, you know, help the family build on their strengths, and give them some education around their weaknesses and what things they can do next. So I think there are lots of, you know, different directions we could potentially go in to try and encourage and to assess whether there are good discussions happening as a result of the interventions. And we're looking into a few different ways.
Sure. And I personally love to find out if there's, I would assume there is some form of kind of correlation with the level of engagement with the type of effect that the intervention had. So yeah, I think that would be a great idea, just to look at also the minutes spent on each page, and all the different methods that you mentioned there.
Absolutely, yeah.
And before I get to my last question, I do already have a different question in chat here. So there's a program in Illinois called Text a Tip, which has licensed counselors to talk to youth in crisis. Could a texting prevention line be programmed to link to a crisis counseling service when there are indications that a youth may need personal help?
I think that is a great idea, and you know, something that I think we've gotten some feedback from on some of our other projects as well. So, you know, we have that cannabis use treatment trial. We recently, just a few days ago, literally completed a pilot project of the cognitive behavioral therapy for depression in young adults. So not exactly what we're talking about here, but text-based intervention, very similarly set up to what we're talking, you know, to the structure that you see here. And I've got ideas for improvement, both of the structure and the content of the intervention. And I think that's one of the things that we've gotten some feedback for, or feedback on, is that folks are saying, you know, we would love to have the option to maybe meet with a counselor, or to be able to talk to someone live. And so in a larger project, we're thinking about, you know, how could we staff to have some, to have some counselors available behind the scenes to be able to chat with folks in crisis. And I think being programmed to sort of, you know, allow folks, either because they texted a crisis keyword or because they chose an option to say, hey, I would like some help, to be able to then reach a live counselor on top of this, I think is, you know, a great option that we are also thinking about. So I'll have to look into that program, but thank you for that.
Awesome. Yeah, thank you for the wonderful suggestions. If anyone else has more questions, please keep them coming. And I have one more question for you here. So through your research, have you discovered any resources that you would recommend coalitions to utilize today? And I ask this because I know that you and your team are in the process of making kind of text-based counseling here more accessible to other members as well, and kind of packaging that. So what about today? Is there anything that you found that is maybe underutilized or something you would want more people to know about?
There aren't a ton that are really available just yet. I think the one that I mentioned earlier, which is really more on the tobacco treatment side, though I haven't looked at it in a while, and I don't know if they have a sort of prevention option, is the smoke-free program that is run by NCI. I think I was saying CDC before, but National Cancer Institute, that really has a lot of research behind it, and has a variety of different options for different subgroups, for teens, for pregnant moms, for older folks. So that's really one of the main text-based resources that I'm aware of. There are, a variety of different text-based programs that are being tested out in the field right now. Several that are, sort of out of Australia and from other countries, but none that I am aware of that we can utilize right at the moment. But saying that, not exactly a resource that can be used at the moment, but as we go forward, we're always looking to partner with more folks and test out these interventions in different communities, different groups, different agencies. So I'm sorry, I was looking at that message pop up.
Sorry.
So I'm always open to, no, that's my own attention. So we're always open to sort of chatting with folks who might be interested in partnering with us and testing this out within their agency or their community, and offering it through that way. Though, unfortunately, there aren't super readily available resources to do text-based stuff just yet.
Gotcha. And actually, we have, if you check in the Q&A box, Dr. Zaharakis, someone had sent you information about Text-a-Tip.
Oh, great. Thank you.
Yeah, more info on Text-a-Tip can be found at linkageefforts.com under textforhelp.app, intended for you. All right.
I appreciate that. And appreciate the option to, the opportunity to talk with you all today, and all the great work that you all are doing out in the field.
Sure. Thank you so much for joining us too today, Dr. Zaharakis. And just to kind of close up here, as I mentioned earlier, I will distribute the slides to those who have participated following this webinar. And I'll also send out an email containing a short evaluation for the webinar. So I just drafted up a couple questions about, I guess, kind of general satisfaction with the webinar, and what kind of takeaways, what are the things that you might want to kind of implement. And so please do fill that out. Once you fill that out, you will get a letter of participation at the end, and you'll have a link to view and download it from the thank you page of that evaluation. And again, you must fill out the evaluation to get the letter, and we recommend that you download it right after you fill it out, just because you will not be able to go back to that thank you page afterwards. In addition, I will be posting the recording of the webinar, so we'll create a YouTube link for everyone to be able to rewatch this, and the resources mentioned. So that will be the paper that Dr. Zaharakis kindly provided us with. We will link that for people to be able to access after this presentation. And so again, thank you so much to Dr. Zaharakis for the wonderful comprehensive presentation on your very exciting findings. We would love to see more kind of accessible forms of counseling, especially in the kind of text-based methods. So thank you for that. And thank you to all the webinar participants for your comments, questions, and attendance. So we'll see you all next time. Thank you so much.
Thank you.